Environmental Pathways to Health. Title sounds little different, but in this talk we will try to see how health and environment are connected to each other and how protecting environment can protect health. You know, environment protection has become one of the important subjects all over the world, and right from Rio, Stockholm to present conferences which we witness, including the recent one at Paris, everybody is talking about issues like global warming, biodiversity, importance of protecting conservation, forests, all that. But all these years, what was happening is there was no connection with the common people. And the reason was why we should protect environment. If you want to answer this question, then people used to say protect environment because our forests are in danger, protect environment because tigers in some forests are getting extinct, they are under threat. Protect environment because some species in some places in the world are getting extinct. Some fish varieties in some sea are in problem, or sea water levels are higher, rising because of global warming. All these subjects are very, very important, but the common man feels that so what? So what? How does it matter to me? If some species in some forests get extinct, how does it matter to me? So in 1992, there was a panel created by the World Health Organization, and this panel was Environment and Health Panel. And in that panel, they realized that you can increase the community involvement in environment protection if you convince them that protecting environment is good for them, is good for their family, is good for their children, and is good for future of their family. The moment you are able to communicate this with people, then their attitude to look at environmental conservation totally changes, and it comes out of the only fashionable or scientific terminologies to something which is very, very close to people, because they now see, I want to protect environment, or I must protect environment because protecting environment is going to protect me in future. So we will see with some examples how these connections are and how protecting environment really can lead us to health, and therefore this talk has been titled as Environmental Pathways to Health. We must understand that today worldwide, if you see how many deaths are occurring by different diseases, the statistics shows us that 25% of total deaths and disease burden is due to environmental factors. And these are direct effects, Almost same component of 25% is because of the indirect effects of environment. But fact remains that 1/4 of the worldwide death and diseases is because of environment, and that's the main reason why we should really protect environment, because ultimately it will prevent 25% of death and diseases. To make this point, I want to take you to a live example which actually happened in 1975 in the United States Congress. You must remember that United States Congress is equivalent something to our Parliament. It's the highest powered decision making or legislative body in the US. In this body, Surgeon General of the United States at that time, W.H. Stewart, made a statement, and what he said? He said, the time has come now to close the book on infectious diseases. You can remember that in 1975, the situation was such that scientists and people also were thinking that we have so many powerful medicines, and now we don't have to worry about these microorganisms. We have first generation, second generation antibiotics, and we are able to kill them, so we don't have to worry about it. And actually they did that. They showed that so many diseases could be eradicated, so many microorganisms can be killed, and therefore this statement was made by the Surgeon General in the United States Congress. Now remember, before making this statement, this is not a casual statement. This is a statement made by the responsible authority in the highest decision making body of the most powerful country in the world. So obviously it has to be backed by very, very sound evidence. What happened that time? The time has come now to close down the book on infectious disease, when John W. Stewart is saying that it was backed obviously by the scientific data. But was it true? In 1975, it might have looked to be true, but then when we go beyond, what is the situation today in this century? If you want to see, just example of 2012. Even today, infectious diseases remain the leading cause of death in the world, killing more people than heart diseases or cancer. This means that we were not able to close down that book of infectious diseases at all. If you really take a stock of situation, what happened from that statement which was made in US Congress in 1975 till today, you will find that the success really has turned sour. And the ambition of closing down the infectious disease book, forget about closing down the book, but this book has multiplied in size. The size has multiplied because every year, starting from 1975, we have witnessed one or more new diseases, or we have also witnessed few diseases which we have been able to eradicate earlier have resurged. For example, in 1975, Lyme's disease came as a new disease. In 1977, hantavirus pulmonary syndrome. In 1978, Legionnaire's disease. In 78, again toxic shock syndrome. In 81, this we may know, AIDS, because it has been discussed quite extensively all over the world, but it came in 1981 as a new disease. In 1989, ehrlichiosis. In 1991, Ebola. And from 2000, in this new millennium, if you see, lot of new diseases we have witnessed, such as swine flu, bird flu, and the most recent, which created scare all over the world, is Zika. So what is happening? Many diseases are really, you'll see that we have been able to put them down, such as guinea worm infection. We have been practically able to eradicate smallpox at that time, and today we have been able to maintain that. Polio, we have been able to control all over the world. Measles, leprosy also has been able to control. So these have gone down, but that's not all. AIDS, avian influenza, Ebola, Marburg, cholera, Rift Valley fever, typhoid, tuberculosis, leptospirosis, malaria, chikungunya, dengue, Japanese encephalitis, and the most important today, what the bigger threat people are experiencing is antimicrobial resistance or multi-drug resistance. This means now we have species of microorganisms which are not able to get killed by any of the known antibiotics or drugs. And the incidence of this is increasing, and this is what is really worrying most of the politicians and scientists. And the question comes that why this is happening? Why this is happening? We have medicines. Scientists are working very hard to create newer medicines. We have powerful medicines. We have powerful antibiotics. But still, we are not able to close down the book on infectious diseases. Why? Today, 3 million deaths occur from diarrhea. 4 million deaths occur from acute respiratory infection, and up to 3 million deaths occur from malaria. Now, it's not that we don't have medicines from this. We have medicines from malaria, we have medicines for diarrhea, we have medicines for acute respiratory infections, but these medicines are not going to be alone responsible for controlling these diseases, because malaria, for example, if you are able to control mosquito breeding, you are able to control malaria. If you are able to manage your water bodies well and don't allow that water to get stagnated, mosquito breeding will automatically get controlled. So these are interconnected things, and therefore alone medicines cannot be used as a controlling measure. The emerging infectious diseases, just to give you a few examples, what point I made, the newly identified and previously unknown infections or agents which cause public health problems either locally or internationally, and we are going to take few examples just in a while. We must remember that many infections are re-emerging, and infectious agents that have been known for some time had fallen to such low levels that they were no longer considered public health problems, which are now showing upward trends in incidence as well as for prevalence in the worldwide. This is really worrying. Factors contributing to this emergence include evolution of pathogenic infection agents, microbial adaptation and change. Some genetic transformations in that microorganism may have happened. Development of resistance to that particular drug. We have seen that many antibiotics after some time, they just don't work. Why? Because microbes develop resistance against these drugs. Resistance of vectors to pesticides. For example, mosquitoes. Earlier, chemicals like DDT used to be used. Now, these mosquitoes are not really giving any response to many pesticides. They just live happily along with the pesticides. So, this kind of a resistance building both in microorganisms and in insects is one of the factors responsible human demographic changes. You see that a lot of urbanization has happened. The human behavior is changing. Sexual habits, drug use, various alcohol and other habits are coming up. Human susceptibility to infection is therefore becoming, a human being is becoming vulnerable to this infection more. Poverty and social inequality are adding to all this. All this has impact on our own body and especially on our own immune system. The climates are changing, ecosystems are changing. So you would see that in some areas, especially in Europe and in Americas, where earlier there were no mosquitoes, today a lot of mosquitoes have suddenly come because of global warming. The temperatures have become conducive and therefore mosquito breeding was possible. Earlier it was not possible, but because of this change in the ecosystem, we are making these kinds of new pathways to disease causing organisms to come near us. Economic and development as well as land use. The land use is changing because of urbanization. A lot of deforestation has happened. The technology and industry is also evolving. The food processing and handling industry. Many a times we don't give that much of care for waste, what we throw out of the industry, and this waste can become important ground. And I'm going to give you a few examples how this kind of a badly managed waste can lead to some pathways which can suffer your health. International travel has increased tremendously, and because of various reasons, today we are able to go from one corner to other corner in the city, and this is another reason why diseases are being transmitted from one region to other. Breakdown of public health measures. There have been wars, there have been unrest, there has been overcrowding, and in general there has been deterioration in surveillance systems. All this put together is responsible for the change which we are seeing, and these changes are primarily responsible because of the environmental changes which are happening around us. The transmission from animals to humans, this what I call it as pathways. These pathways are created. How animals to human transmission can occur. For instance, 2/3 of the emerging infections originate from animals. They are wild or domestic. The emerging influenza infection in humans is associated with geese, chickens and pigs. Animal displacement in search of food and deforestation, climate change can cause fewer diseases like Lassa. Humans themselves penetrate, modify unpopulated region, and automatically they come closer to the reservoirs or vectors, and therefore they are getting more close to getting different kinds of infections. The climate and environmental changes are considered now as one of the most important factor in this disease imbalance which we are seeing all over the world. For example, deforestation forces animals into closer human contact, and because of that there is increased possibility of agents to breach species barrier between animals and humans. For example, earlier when those animals were just living in forests and there was no human contact, although the infectious microbes were sitting in those animals, they were not able to get to human beings anywhere near, and therefore those disease transmission was not possible. Also, because of climatic change, there are effects like El Nino effect, which triggers natural disasters, releases outbursts of infectious diseases like malaria and cholera because of heavy rainfalls, devastating floods and other things. There is global warming. Because of global warming, as I told you, spread especially because of mosquitoes and mosquito-linked diseases like malaria, dengue, leishmaniasis, filariasis, all these are on increase. The poverty, neglect and weakening of health infrastructure is another important reason, but again these are connected with the surrounding environments. The poor populations, the major reservoirs and sources of continued transmission. Poor people live in environment where they are able to really very easily get exposed to agents, disease causing vectors like mosquito. Poverty, malnutrition. Because of poverty and malnutrition, your entire immune system gets suppressed and you are able to really expose to diseases very easily. A lack of funding, poor prioritization of health funds, misplaced in curative, rather preventive infrastructure. Another important point, what I want to stress here, is our entire healthcare system is focused on curative as against preventive. For example, instead of focusing our effort on curing malaria, if we are able to prevent malaria by controlling simple things like controlling mosquito breeding, we will be able to make people more happy. Failure to develop such adequate health delivery system is also responsible for this resurgence of many diseases. The uncontrolled urbanization and population displacement is one more reason, wherein growth density in populated cities give chance for spreading diseases very easily. Because people in the crowd come in contact with each other very easily, and therefore microbes or pathogens can get transmitted from one person to other person relatively easily. The problems of refugees and displaced persons are also faced in various worlds. We saw recently what happened in Europe. Diarrheal and intestinal parasitic diseases, Lyme's diseases, they are all because of the changes in the Lyme disease example. I am going to take after a few minutes as an example of how environmental pathways are important. Let's skip this slide, and I want to take you to actually, as I mentioned, antimicrobial drug resistance is coming up as a major threat. There are many reasons. We are not going to discuss those reasons because some of them are not directly related to environment, but the environmental reasons for antimicrobial drug resistance are also important, and therefore I wanted to stress this point. I want to give you another example again from a country like America, which is a advanced country, rich country, but tuberculosis, which was considered to be disease of poor, it was considered as disease of the third world. It was practically unexisting in rich world. But now if you see what has happened in the United States itself, incidence of tuberculosis has increased to almost 18%, with 26,000 plus cases reported in 1992. In New York City, which is kind of a financial capital of United States, there has been increase of nearly 150% since 1980. Tuberculosis has increased in Europe. Italy reported almost 28%, Switzerland experienced about 33%, just between the time span of 86 to 90. In 1991, 8 million new tuberculosis cases were reported worldwide, and 1/3 of the world's population is now estimated to be carrying the infection. Now remember again the first slide where I told you, wherein that statement was made that there is a time has come now to close down the book on infectious diseases. These examples don't really tell us that we are going anywhere near that kind of a big loud goal. Not only tuberculosis, many other diseases which we were able to really eradicate, such as diphtheria, have re-emerged. We saw, I put their question mark because still there is no agreement among scientists whether that was plague or not. resurfaced in India, sometimes. The malaria, cholera, dengue have resurged again in a very large quantities and numbers. WHO has actually warned pandemic spread of dengue, and all of us are witnessing, especially in seasons where mosquitoes breed, during rainy seasons, the dengue and other more serious forms of dengue like dengue shock fever are skyrocketing. Yellow fever. The number of cases in Africa alone has increased from few hundred a year in the late 1940s to an estimated to 200,000 per year. If you look at the global map of dengue or dengue hemorrhagic fever, you will see that the red color is after 1960. Prior to that, it was just in small pockets. Those yellow pockets which you see, their dengue was only in those smaller regions. And now practically it has, this red map is also little old. Now you will find that it has spread even in most other parts, and therefore WHO has said pandemic. Pandemic meaning now this disease has taken a global presence. Virtually, we must remember that all pathogens are regarded as new where previously existed in nature. The emergence as new agents of the disease has generally resulted not from pathogens changing, but because of the social conditions, because of the environmental changes, because of the new pathways which we have created so that they are able to access new hosts. And because of this, they are becoming available, accessible, and they are becoming more virulent because the host, that is human being, is becoming immunocompromised. So all these reasons are put together. Because of that, you will see that diseases are resurging, new diseases are coming, old diseases are coming back again. You must look at this kind of an interesting flow chart which you see on the screen, wherein I have put human being at the central. Now, human being at the central, we are governed by the environment around us. In that environment, animals live, vectors live, microorganisms live, and there is a continuous interaction between us and them. And this interaction gets influenced because of climate change, because of pollution, because of urbanization, because of migration. All these activities which I told you are because of these interactions. More the interactions, more is the possibility or more is the risk of getting the disease. For example, if you have more interaction with the area wherein mosquitoes are breeding, you are having more risk of getting diseases like malaria and dengue. In this, I want to now take you to an important component of the talk, what I call it as health. We talk about health, but you will realize that in your mind, when I talk to you about health, most of us will think of medicine. Somehow we have got notion in our mind that we are able to get health by getting medicine, or we are able to get health by going to doctor. But please remember that health is something which is in our hand, and there are only 4 factors which determine whether an individual or a community will remain healthy or not. These factors, we call them as major determinants of health. And there are 4 major determinants of health. And the 5th determinant of health is also there, which I will tell you. The first determinant of health is nutrition. The kind of food we take, the kind of amount of food we take, the quality of food we take, and based on that our body is built. So if you have poor nutrition, your body gets suffered. Nutrition has direct link with immunity. If poor nutrition is there, your immunity is poor, and because your immunity is poor, you are liable to get more infections. Because of many deficiencies of nutrients, you can get many diseases also. The second important factor in or determinant of health is lifestyle. Now this lifestyle, you will see that especially in India, we are facing what we call it as double burden of disease. What is this double burden of disease? We have diseases of poor, like tuberculosis or malaria or dengue. These are normally in tropical countries, in poor countries. We are retaining them. We have those. In addition, we have adopted Western lifestyle. We adopted Western type of nutrition. Pizza, burgers have become common now in urban areas. Or even fine foods like breads and biscuits are becoming common in our area. And that all has impact on our health. The lifestyle in general has changed. The stress levels in our communities are going high because of today's lifestyle, and all that is impacting on our health. The third component of that is heredity, and coming to environment at the end. Heredity is something which we are born with. Our health also depends, by the way, on what our parents have done, what our mother has done, what she has ate during the pregnancy. All those components, how was her nutrition, how was her lifestyle, all that impacts on our health as well. So heredity is another thing, but heredity is something which you carry, and there is very little what you can do except in some preventive strategies. Heredity is something which is not totally in our hand. But the last component, environment, today's lecture is on focusing more on environment as determinant of health. You will find that, and we saw in the earlier slide, that 25% of the health related problems and diseases are related to environment. Now it's interesting to see that other than heredity, nutrition, lifestyle and environment are actually in our control. We can decide whether to take good nutrition or bad. We can decide to adopt a good lifestyle or not. We can decide to stay in a good environment or not. These are actually in our hand. Environment, you will say, may not be 100% in our hand, because I am living in Pune. If I am traveling on Pune's roads which are polluted, if I am traveling on two-wheeler or bicycle, I am exposed to automobile pollution, fumes and particulate matter. It is impacting on my health. So these are the four determinants of health in which environment emerges out as one of the very, very important and major determinant of health. The last, fifth determinant of health, which we call it as weak determinant of health, it's like a building. Building is strong if the foundation is strong. Building is strong if the four pillars on which its roof is rested is strong. If any one of these four pillars become weak, then what you do? You get some support system, right? Because these are the four pillars: nutrition, lifestyle, environment and heredity. These are the four pillars of our health. If any one of them becomes weak, then you require a support system, and that support system, what we call it as medical care. In general, in our country or in many other countries, it is also called as health care. But actually what we get is medical care. So if these four fail, then medical care is required. So our objective should be actually not to go to medical care and prevent our health, protect our health. And if we are able to protect environment, we will be able to protect our health. Now at this stage, I want to really take you to the definition of health. We talk about health, but what is health? The World Health Organization has defined health as a state of physical, mental and social well-being. It is not just an absence of a disease or deformity. So health is something which is present at physical level, my body, mental level, my mind, and social level, my surrounding. All that is responsible for health. Just because I may not have a disease doesn't mean that I am healthy. I must tell you that if we talk about health versus disease, disease is something which is negative, health is something which is very positive. If I want to gain health, I should participate actively in gaining health. Nobody else can give me health. Doctors can cure diseases, but they cannot give you health. And by the way, doctors cannot tackle all the diseases also. They may give you medicines for some diseases, but some diseases which were controlled, for example, cholera, typhoid, doctors did not control cholera and typhoid. In the West, nutritious food, safe drinking water, and techniques like pasteurized milk actually did this magic. Because of pasteurized milk, the cholera and typhoid were controlled. The nutritious food actually controlled many diseases. Immunization is responsible for wiping of smallpox or controlling of diphtheria, tetanus and polio, and not antibiotics. Antibiotics are there if you have the disease, but immunization is there to protect you from the disease. So vaccination is more preventive and antibiotics are more curative. Now health goes beyond this. Health has many layers, and health is at the first level. You can see that environment is the most important layer, wherein health related issues are discussed. Outer cover to that is social environment and social conditions. We are also gone by commercial and political environment, economic environment outside. So all these layers, one after the other, are responsible for my health and community health or people's health. So health is just beyond treatment and taking some medicines. Now we will take a break of 5 minutes, and then I'm going to actually give you some examples, actual real life examples of how environmental change and human health are connected to each other, and how the environmental pathways can lead to either health, and if we take a wrong path on environment, that is deteriorating environment, then it can take us to disease.